We do, we have some of the products here that we dispense, the antioxidants, the retinols. We have all of those here. We have, we do chemical peels. So chemical peels are also a nice way if you want to ease into procedures. Chemical peels are a nice way to do it. They're usually better done as a series of like anywhere from 3 to 6. You get a nice effect just from one, but an even better effect by doing a series of them. And that's for discoloration, fine lines, texture, tone. And then we have a laser that can do this profractional that I mentioned earlier, which is partially ablative resurfacing. So that I've seen amazing results with it. And I was just at a talk at a conference recently, and this is sort of what everybody's doing. I didn't realize everybody was doing it, but so it's basically like aerating a lawn of grass. The laser pokes tiny little holes all over the skin. And the idea is if you have a wound, the body then produces collagen to fill that wound. And when we do it in a partial way, it's much safer than the Foley ablative, where you're basically knocking the whole face off. Doing it in a partial way, about 25% of the skin at a time, you heal. You have a couple days where you have to wear Aquaphor all over your face and you're a greasy mess. But after that, you can put makeup right back on after those few days of Aquaphor, along with your sunscreen, and have fantastic results with the resurfacing. That also is meant to be done as a series. You don't have to do it that way, but it's meant to be done as a series because if we're doing about 25% of the skin at a time, if we do about 4 treatments, then we theoretically are resurfacing the entire face. So that is really, it's a phenomenal treatment. We also have the laser. We can do red spots, we can do brown spots, we can do hair laser removal, all of those things. So New Jersey actually has the strictest laser laws of any state, and that means that only a practitioner, a physician can operate a laser in this state, which I think is, I mean, I'm obviously biased, but I think that that is a very smart law because you can do a lot of damage with lasers. So you want to be very careful about where you have that done as well, just like you would with any of the injectables that you might get. You want to be very careful about that as well. You can burn, you can blister, you can have permanent scarring. All of those things can occur. And so lasers are not, they might seem straightforward to some people, to some estheticians, but they're absolutely not at all. So, so we have the lasers that can do that as well.